What is the All Me Augmentation? The All Me Augmentation is a novel approach to breast augmentation. Traditionally, breast augmentation has been done with implants. Well, implants have issues, they have problems. The All Me Augmentation borrows some techniques from cancer surgery, which we use to rebuild the breast, in order to augment the breast with natural living tissue that's transplanted from the abdomen, giving the patient a nice abdominal appearance, almost exactly what we do in a tummy tuck. But instead of throwing that tissue away, I use that tissue to augment the breast to give a natural, beautiful breast augmentation. Why is the All Me Augmentation performed? The All Me Augmentation is performed for a variety of reasons. The most common reason is patients who have had breast implants and are experiencing complications of those implants. Those include breast implant illness and capsular contracture. The All Me Augmentation allows removal of the implants with a total capsulectomy to completely resolve those issues, and at the same time to augment the breast with natural living tissue that's transplanted, not grafted, so the patient can get a consistent augmentation with no reabsorption of the fat. What is the difference between the All Me Augmentation and fat grafting? Trying to augment the breast with natural tissue is not a novel concept. Many surgeons perform fat grafting. With fat grafting, fat is liposucked from part of the body, it's filtered and then injected into the breast. The problem is that only approximately 10 to 30% of that fat will survive the transplantation process. That means that it's difficult to get a consistent augmentation with fat grafting. Furthermore, fat grafting has risks including embolism and possible stroke and even DVT and death. By doing the All Me Augmentation, we transplant the tissue, which means we're bringing that tissue along with the blood vessels that keep it alive, so we have a consistent augmentation, which not only is 100% with natural tissue, but I can give the breast a nice shape because of the nature of the transplanted tissue, and there's no resorption. Everything that gets transplanted survives the transplant. Why do more people not offer the All Me Augmentation? Well, the All Me Augmentation is a novel procedure. In order to do the All Me Augmentation, the surgeon has to have significant experience with cancer reconstructive surgery. You also have to have significant experience with cosmetic surgery. By merging the two disciplines and the cross-pollination of reconstructive microsurgery and cosmetic surgery, I'm able to offer a new option for patients so they can get consistent breast augmentation without using implants. What is the most common reason people undergo the All Me Augmentation? The most common reason people undergo the All Me Augmentation is for breast implant illness. Well, the question is, what is breast implant illness? Well, it is a vague collection of symptoms that occur in patients who have had breast augmentation with implants. Those include hair loss, fatigue, joint pains, muscle pains, sleeplessness, difficulty with weight gain or weight loss, in addition to several other symptoms that can occur. What breast implant illness is a reaction of the body to the implants. Now, the cure for breast implant illness is to remove the breast implants along with the capsule in what we call a total capsulectomy. The thing is that many patients still like the way their breasts look with the augmented volume. So the All Me Augmentation allows you to choose to get rid of your implants, along with it the symptoms of breast implant illness, but maintain your breast volume so that you can have both the aesthetics that you desire and your health that you need. What are other reasons people undergo the All Me Augmentation? Well, breast implant illness is the most common reason that people undergo the All Me Augmentation. But there are other reasons why people have this done as well. The two main other reasons are patients that have capsular contracture, which means that their body is forming a tight shell around the implant, which can be painful and disfigure the breast. The reality is that repeat implants for patients who have capsular contracture have an incredibly high rate of reforming a capsule. The only way to guarantee that there's no capsule is to remove the implant and the capsule in its entirety. And when we do that, we can use the All Me augmentation to augment the breast so the patient has a nice aesthetic breast augmentation that they truly love. The other reason why patients can undergo an All Me augmentation is that they're simply afraid of implants. Implants are scary. There's a lot of unpredictability with them, and people don't want something foreign in their body. So many patients will choose a primary augmentation with the All Me augmentation, especially if a patient also has complaints of the way the abdomen looks. Because in reality, the two most common surgeries that are performed together in the United States as far as cosmetic surgery would be an abdominoplasty with a breast augmentation. And it makes no sense to take that abdominal tissue that you have and throw it in the trash and then put an artificial implant in the breast when we can simply take that abdominal tissue and use it to augment the breast so you can have a natural, good-looking augmentation that lasts forever without the risks of capsular contracture or breast implant illness. What is actually being done with the All Me augmentation? The All Me augmentation is a procedure where we augment the breast using the abdominal tissue. So the question is, what is actually done in the All Me augmentation? Well, the All Me augmentation starts with a tummy tuck. It's done in the exact same way as I normally perform a cosmetic abdominoplasty. That means the patient has liposuction to highlight the waist, tightening of the muscles or the diastasis recti that most often occurs with pregnancy, and removal of the lower abdominal skin and fat. That augmentation, that abdominoplasty is done in the exact same way as it is done in every other abdominoplasty. The only difference is that with the abdominal tissue, I also take a blood vessel that keeps that tissue alive while doing the abdominoplasty. In the breast, it's performed the exact same way as a subglandular breast augmentation with an implant. The only difference is, instead of using an implant, I use the abdominal tissue as the implant to augment the breast. I also have to prepare a blood vessel in the chest to attach the blood vessels that are coming from the abdomen so that tissue is alive. Because when it has good blood flow, that tissue will survive 100% and provide the patient with a beautiful looking breast augmentation with their own tissue that lasts forever. Do you perform a total capsulectomy with the All Me augmentation? When a patient has breast implants that have problems, either capsular contracture or breast implant illness, we typically perform something called a total capsulectomy. Well, what does that mean? Well, that means that we don't just take out the implant, we take out the implant along with the shell of scar tissue that is surrounding the implant. We do this for many reasons. One, by keeping that shell intact and removing the entire shell, we don't have to worry about leakage of silicone in a ruptured silicone implant into the body. Also, I believe that there are many inflammatory mediators in the capsule, and by removing all of that capsule, we also remove the inflammatory mediators that can cause a lot of problems. So when we do a All Me augmentation, and the patient has breast implants, we will often perform the total capsulectomy in order to cure the breast implant illness and to prevent any issues with a chronic capsule. What are the risks of the All Me augmentation? The All Me augmentation, like any surgery, has risks. The main risk to the procedure, like any cosmetic surgery, is the risk of blood clots in the veins, called DVT. DVTs are an extremely dangerous complication that can occur. Now, with the All Me augmentation, all of the patients are placed on a blood thinner after surgery. This very powerful drug helps mitigate or decrease that risk of blood clots. In addition, we have specific instructions to get up and walk around every hour or two in order to get the blood flowing so that blood clots are less likely to form. Even with this, the risk of blood clots is incredibly small, but cannot be understated. Other risks include the risk of surgery, like infection, bleeding, and even the devastating risks that can occur, like heart attacks or strokes. That being said, the unique risk to the All Me augmentation is that the blood flow doesn't work. In order for this tissue to survive, the blood vessels have to be properly put together. If that doesn't happen, or the body rejects the blood vessels for any reason, then the tissue will not survive the transplantation. Now, fortunately, this is also an incredibly low risk, in the order of 1 in 1,000, but it's not zero, and we have to understand these risks before you undergo the All Me augmentation. What is the recovery like for the All Me augmentation? The recovery for the All Me augmentation is like that of any surgery in that there is some variability among patients. I tell most patients to expect to have some element of pain for somewhere between 3 and 7 days. After about 7 days, the pain is significantly mitigated. Most patients can go back to working at home or from a computer at approximately 2.5 to 3 weeks. Most people will go into their jobs in person at approximately 3.5 to 4 weeks. As far as exercise and physical activity, I tell patients to refrain from exercise, especially the type of exercise that engages the core muscles, for approximately 5 to 6 weeks. After 7 weeks, there are no restrictions, though I tell patients to try and avoid swimming with sharks or skydiving. How long does it take to perform the All Me augmentation? The All Me augmentation is an extensive surgery. It is more than a typical abdominoplasty and breast augmentation with implants. As a result, the time of surgery is slightly longer. It takes approximately 6 hours to perform an All Me augmentation. However, with variability such as a total capsulectomy or a mastopexy or a breast lift that is often performed with the All Me augmentation, it can take up to 7, even 7.5 hours to perform. In order to be eligible for the All Me augmentation, the patient must be in good health. That is, they must be able to walk up approximately 3 flights of stairs without becoming short of breath. In addition, the patient cannot have any serious underlying heart, liver, or kidney disease. Furthermore, patients who have undergone a prior abdominoplasty, which includes an incision around the belly button, are no longer candidates for the All Me augmentation because the blood vessels necessary to transplant the tissue have likely been divided with the prior surgery, making it impossible to perform the All Me augmentation. What happens if I gain or lose weight after the All Me augmentation? The All Me augmentation is a transplant of the patient's own abdominal fat and skin to the breast to augment the breast. So what happens if you gain or lose weight? Well, the reality is that tissue doesn't know that it's been transplanted or moved to the breast. It will behave the same way as it would in the abdomen. So if a patient undergoes the All Me augmentation and gains a significant amount of weight, the breast will get significantly larger. Furthermore, if you undergo an All Me augmentation and then lose weight, the breast will lose volume with the weight loss. I recommend patients to be at a stable weight before they undergo the All Me augmentation. What happens if I get breast cancer in the future? Breast cancer is a significant consideration for someone undergoing an All Me augmentation. 1 in 9 women in the United States will have a breast cancer diagnosis in their lifetime. Fortunately, the way the All Me augmentation is performed, the tissue is placed beneath the pectoralis fascia. Therefore, if a patient were to unfortunately have a breast cancer diagnosis in the future, the mastectomy can be performed in the exact same manner, leaving the All Me augmentation tissue behind. So the patient would, in essence, undergo a mastectomy, but still have some of the breast remaining from the All Me augmentation. Who is the ideal candidate for the All Me augmentation? The ideal candidate for the All Me augmentation is someone who wants an abdominoplasty to improve the shape of the abdomen at the same time that they want an augmentation of the breast. Because in essence, we can do both procedures at the same time using the abdominal tissue as the implant instead of an artificial material that has the potential for issues and problems in the future. Does the All Me augmentation look more natural? The All Me augmentation is a more natural way to augment the breast. Natural in the fact that there's no foreign material added to the body. But also, the tissue that's transplanted to the breast is natural in its appearance as well. There's no unnatural, high shelf look that you can often have with a breast implant. Instead, the tissue takes a very natural shape as you'd find in an ideal shaped breast. As far as the size of the All Me augmentation, in your consultation, I will review with you the exact size that you would like to be. We'll use sample sizers to shape the breast so you can make a decision of the volume of augmentation that you want. Assuming that your abdomen has the appropriate amount of tissue, which I will give you a good estimate on in your consultation, you will be able to choose the exact size of augmentation that you undergo. What are some other reasons that women would choose the All Me augmentation? Women will choose the All Me augmentation for several reasons. The main reason all comes back to the same basic premise. That is that you want an augmentation of the breast with your own natural tissue, avoiding any foreign implants. This can be done as a primary breast augmentation or to treat complications of breast implants. How does the All Me augmentation affect my overall body proportions? The All Me augmentation is an augmentation of the breast with natural tissue simultaneously performed with an abdominoplasty procedure. With this procedure, the patient can expect for a narrowing of the waist, which will be done with a combination of the abdominoplasty, which includes the tightening of the muscles that have been loosened with pregnancy, along with liposuction of the flanks in order to shape the waist. Also, with the breast augmentation, a mastopexy or breast lift can be performed to raise a sagging or low-sitting breast. In the end, the patient should have a high, natural-shaped breast with a tightened waistline and an overall hourglass figure. If you have more questions about breast implant illness or the All Me augmentation, reach out to me either on social media, follow me on YouTube, or you can even pick up the phone and call the office.